Hello everyone, and welcome back to my channel. Thank you for joining us today. We're here to discuss an important health topic that often doesn't receive the attention it deserves: mouth cancer. Mouth cancer, also known as oral cancer, refers to the development of malignant cells in the tissues of the mouth, including the lips, gums, tongue, and the lining of the cheeks. This type of cancer can manifest in various forms, and its early symptoms might be easy to overlook, such as persistent sores or lumps in the oral cavity, difficulty swallowing, or changes in speech. Awareness of mouth cancer is crucial for early detection and treatment, as the disease can be aggressive and life-threatening if not diagnosed in its early stages. By spreading knowledge about risk factors, such as tobacco and alcohol use, HPV infection, and poor oral hygiene, we can empower individuals to take proactive steps towards prevention and seek regular dental checkups. Today, we'll delve deeper into the signs and symptoms of mouth cancer, discuss the latest research and treatment options, and highlight the importance of maintaining good oral health for overall well-being. Let's begin. Mouth cancer, also known as oral cancer, is a type of cancer that develops in the tissues of the mouth or throat. It can occur in various parts of the oral cavity, including lips, tongue, cheeks, gums, roof, palate, or floor of the mouth, throat, oropharynx. Symptoms of oral cancer: persistent sores or ulcers in the mouth that do not heal, a lump or thickening in the cheek, white or red patches on the gums, tongue, or other areas, difficulty chewing, swallowing, or moving the jaw, numbness or pain in the mouth or lips, loose teeth or ill-fitting dentures, persistent sore throat or hoarseness. Causes and risk factors. While the exact cause of oral cancer isn't always clear, the following factors increase the risk. 1. Tobacco use, smoking cigarettes, cigars, or pipes, and chewing tobacco. 2. Alcohol consumption, excessive alcohol intake. 3. HPV infection, certain strains of the human papillomavirus. 4. Sun exposure, prolonged exposure to the sun, which can cause lip cancer. 5. Poor oral hygiene, neglecting oral care. 6. Weakened immune system. Diagnosis and treatment. Diagnosis: dentists or doctors may notice signs during routine checkups. Biopsy imaging tests, MRI, CT, PET scans, or endoscopy may confirm the diagnosis. Treatment options: surgery to remove the tumor, radiation therapy using high-energy beams to kill cancer cells, chemotherapy using drugs to target cancer cells, targeted therapy blocking specific molecules involved in cancer growth. Early detection is crucial for effective treatment and better outcomes. Regular dental checkups can help spot signs early. If you notice unusual changes in your mouth, consult a healthcare provider promptly. Performing a self-examination of your mouth regularly can help detect potential signs of oral cancer or other abnormalities early. Here's how to do it. How to perform a mouth self-examination. 1. Set up. Find a well-lit space with a mirror. Wash your hands thoroughly before starting. Use a small flashlight if the lighting isn't bright enough. 2. Check your lips. Look for lumps, discoloration, sores, or unusual texture. Gently feel for bumps or thickened areas with your fingers. 3. Inspect the inside of your cheeks. Pull your cheeks back and look for white or red patches, sores, or lumps. Feel for any irregularities with your fingers. 4. Examine your gums. Look for swelling, discoloration, or sores on the gums. Check if your gums bleed easily when touched. 5. Check your tongue. Stick out your tongue and look at the top, sides, and underside. Note any discoloration, lumps, or sores. Gently press on different parts of your tongue to feel for any unusual bumps. 6. Inspect the roof and floor of your mouth. Tilt your head back to view the roof of your mouth. Look for discoloration or irregularities. Use your fingers to feel the floor of your mouth for lumps or swelling. 7. Observe the back of your throat. Open your mouth wide and say, "Ah." Look for redness, swelling, or unusual patches. 8. Feel your jaw and neck. Gently press along your jawline and neck for lumps, swelling, or tenderness. What to look for: non-healing sores or ulcers lasting more than 2 weeks. White or red patches. Lumps, swelling, or thickened areas. Pain, numbness, or tenderness. Persistent sore throat or difficulty swallowing. When to seek help. If you notice any unusual changes or symptoms that persist for more than 2 weeks, schedule an appointment with a healthcare professional or dentist. Regular self-checks combined with professional dental visits can significantly increase the chances of early detection. Mouth cancer, or oral cancer, occurs when cells in the mouth undergo abnormal changes and grow uncontrollably, often forming tumors. Several factors can contribute to this transformation. Below are the primary causes and risk factors. Causes and risk factors of mouth cancer. 1. Tobacco use. Smoking, cigarettes, cigars, and pipes are major risk factors. Chewing tobacco, betel quid, gutka, or snuff can irritate oral tissues, increasing cancer risk. Tobacco use is linked to a significant percentage of mouth cancer cases. 2. Excessive alcohol consumption. Heavy drinking can irritate the cells in the mouth, making them more susceptible to cancer-causing agents. The combination of alcohol and tobacco use greatly increases risk. 3. Human papillomavirus, HPV. Certain strains of HPV, especially HPV-16, are associated with cancers in the oropharyngeal region, back of the throat, base of the tongue, and tonsils. 4. Sun exposure. Prolonged exposure to ultraviolet UV rays can cause lip cancer, particularly in individuals who work outdoors. 5. Poor diet. A diet lacking fruits and vegetables, low in antioxidants, can increase vulnerability to cancer. 6. Weakened immune system. Conditions or medications that suppress the immune system may increase cancer risk. 7. Chronic irritation. Persistent irritation from ill-fitting dentures or sharp teeth may increase the risk, though this is less common. 8. Family history. A genetic predisposition or family history of cancer may contribute to the risk. 9. Age and gender. Mouth cancer is more common in people over 40 and slightly more prevalent in men than women, although rates among women have been increasing due to higher tobacco and alcohol use. 10. Poor oral hygiene. Neglecting oral health and hygiene can increase the risk of developing oral cancer. Prevention tips. Avoid tobacco, quit smoking, and avoid smokeless tobacco products. Limit alcohol, drink in moderation or avoid it altogether. Sun protection, use lip balms with SPF and avoid excessive sun exposure. Healthy diet, eat plenty of fruits, vegetables, and whole grains. Vaccination, get vaccinated against HPV. Oral hygiene, brush and floss regularly and visit a dentist for checkups. If you're concerned about your risk factors, regular checkups and open communication with your healthcare provider can help with early detection and prevention. Mouth cancer, or oral cancer, can present with a range of symptoms that may vary depending on its location and stage. Early detection is critical, so it's important to recognize these signs and seek medical attention if they persist. Common symptoms of mouth cancer. 1. Persistent sores or ulcers. A sore or ulcer in the mouth that does not heal within 2 weeks. May be painful or painless. 2. Unusual lumps or growths. A lump, swelling, or thickened area in the mouth, neck, or jaw. May feel firm or uneven. 3. White or red patches. Leukoplakia, white patches. Erythroplakia, red patches, often more concerning than white patches. Mixed red and white patches may also occur. 4. Persistent pain. Pain or discomfort in the mouth, throat, or tongue. May radiate to the ears or other areas. 5. Difficulty swallowing. Feeling like something is stuck in the throat. Pain or difficulty chewing, swallowing, or moving the jaw or tongue. 6. Changes in voice. Hoarseness or persistent changes in the voice. Slurred speech or difficulty speaking clearly. 7. Loose teeth or poorly fitting dentures. Teeth becoming loose without a clear reason. Dentures that no longer fit comfortably due to swelling or changes in the jaw. 8. Numbness or tingling. Unexplained numbness or tingling in the mouth, lips, or tongue. 9. Bleeding or persistent soreness. Bleeding from the gums or other areas of the mouth without clear cause. Persistent sore throat or feeling of irritation. 10. Swollen lymph nodes. Enlarged or tender lymph nodes in the neck. 11. Bad breath. Persistent bad breath, halitosis, not linked to oral hygiene. 12. Weight loss. Unexplained weight loss, especially in advanced stages. When to see a doctor. If you notice any of these symptoms lasting more than 2 weeks, consult a healthcare professional or dentist immediately. Regular dental checkups can also help identify abnormalities early, even before symptoms become noticeable. Early detection significantly improves treatment outcomes. How to prevent mouth cancer. Prevention is key to reducing the risk of developing mouth cancer. Here are some strategies. 1. Avoid tobacco products. Do not smoke cigarettes, cigars, or pipes. Avoid chewing tobacco, betel quid, or any smokeless tobacco products. 2. Limit alcohol consumption. Drink alcohol in moderation or avoid it altogether, as excessive alcohol consumption increases risk. 3. Protect your lips from sun exposure. Use lip balms or sunscreen with SPF. Wear wide-brimmed hats to shield your face from the sun. 4. Maintain good oral hygiene. Brush and floss daily. Visit your dentist regularly for checkups and professional cleaning. 5. Eat a balanced diet. Include plenty of fruits, vegetables, and whole grains, which are rich in antioxidants and vitamins. Avoid a diet high in processed and sugary foods. 6. Get vaccinated against HPV. Certain types of human papillomavirus, HPV, can increase the risk of oral cancer, so getting vaccinated is a proactive measure. 7. Address ill-fitting dentures or dental issues. Correct poorly fitting dentures or dental appliances that may irritate your mouth. 8. Avoid chronic irritation. Minimize habits like biting the inside of your cheeks or lips, which can cause long-term irritation. 9. Avoid secondhand smoke. Exposure to secondhand smoke can also increase cancer risk. 10. Regular self-examinations. Perform routine self-checks of your mouth to spot early signs like sores, lumps, or discoloration. Treatment options for mouth cancer. The treatment for mouth cancer depends on the stage, size, location, and type of cancer. Common treatment options include 1. Surgery. Tumor removal, removing the cancerous tumor and some surrounding healthy tissue. Reconstructive surgery, restoring function or appearance after tumor removal, e.g., jaw reconstruction. 2. Radiation therapy. High-energy beams target and destroy cancer cells. Often used after surgery to eliminate remaining cancer cells or as the primary treatment for smaller tumors. 3. Chemotherapy. Anti-cancer drugs are used to kill or stop the growth of cancer cells. Can be combined with radiation therapy for advanced cases. 4. Targeted therapy. Drugs designed to target specific molecules involved in cancer growth, e.g., cetuximab. 5. Immunotherapy. Stimulates the immune system to recognize and fight cancer cells. Typically used for advanced or recurring cancers. 6. Palliative care. Focuses on relieving symptoms and improving quality of life for patients with advanced cancer. Post-treatment care. Regular follow-ups to monitor for recurrence. Speech and physical therapy to restore oral function if needed. Lifestyle changes to minimize future risks. Early detection and prevention remain the most effective strategies. If you are at risk or notice concerning symptoms, consult a healthcare provider for evaluation and advice. The treatment of mouth cancer typically involves a combination of therapies, including surgery, radiation, and chemotherapy. Medications are primarily used in chemotherapy, targeted therapy, or immunotherapy to destroy or inhibit cancer cells. Below are the key medications and drug classes commonly used in the treatment of mouth cancer. 1. Chemotherapy drugs. Chemotherapy uses powerful drugs to kill cancer cells or stop their growth. Commonly used chemotherapy drugs for mouth cancer include cisplatin, a platinum-based drug that damages cancer cell DNA and prevents them from dividing. Carboplatin, similar to cisplatin but with fewer side effects. Fluorouracil, 5-FU, interferes with DNA and RNA synthesis, inhibiting cancer cell growth. Docetaxel, a taxane drug that disrupts cancer cell division. Paclitaxel, another taxane drug, often used in advanced cancers. Methotrexate, blocks the metabolism of cancer cells, preventing their growth. 2. Targeted therapy drugs. These drugs specifically target proteins or genes involved in cancer cell growth and survival. Cetuximab Erbitux targets the epidermal growth factor receptor, EGFR, a protein that helps cancer cells grow. Often used in combination with radiation therapy or chemotherapy. 3. Immunotherapy drugs. Immunotherapy boosts the immune system to fight cancer cells. These are typically used for advanced or recurrent cancers. Pembrolizumab Keytruda, a PD-1 inhibitor that helps the immune system recognize and destroy cancer cells. Nivolumab Opdivo, another PD-1 inhibitor used for cancers that have not responded to other treatments. 4. Pain management and symptom relief. Medications to manage symptoms or side effects of treatment. Pain relievers. Nonsteroidal anti-inflammatory drugs, NSAIDs, opioids, morphine, oxycodone, or acetaminophen. Mouth rinses. Special rinses containing lidocaine or antiseptics to soothe mouth sores. Anti-nausea drugs. Ondansetron, metoclopramide, or dexamethasone for chemotherapy-induced nausea. Saliva substitutes or stimulants. Pilocarpine or artificial saliva to manage dry mouth caused by radiation. 5. Medications for radiation therapy side effects. Amifostine, ethyl, used to protect healthy tissues from radiation damage. 6. Antiviral, antifungal, or antibiotic medications to treat infections in the mouth, which are common due to weakened immunity. Important notes. 1. Drug combinations. Many of these drugs are used in combination for better effectiveness. 2. Side effects management. Medications to address side effects, e.g., nausea, fatigue, or mouth sores, are an integral part of the treatment. 3. Consultation. Always consult an oncologist to determine the most appropriate medication based on the cancer stage, location, and individual health conditions. Early diagnosis and personalized treatment plans, often involving a combination of these medications, can significantly improve outcomes in mouth cancer treatment. Chemotherapy is an effective treatment for mouth cancer, but it can cause a range of side effects due to its impact on both cancerous and healthy rapidly dividing cells. The side effects vary depending on the specific drugs used, dosage, and individual health. Below are the most common side effects of chemotherapy for mouth cancer. Common side effects of chemotherapy. 1. Gastrointestinal issues. Nausea and vomiting, often triggered by chemotherapy drugs, though anti-nausea medications can help. Diarrhea, due to irritation of the gastrointestinal lining. Loss of appetite, changes in taste or smell can make eating difficult. Mouth sores, mucositis, painful ulcers or sores in the mouth, making it hard to eat or talk. 2. Fatigue, a common side effect due to the body's increased effort to repair normal cells affected by chemotherapy. 3. Hair loss, alopecia. Not all chemotherapy drugs cause hair loss, but some can lead to partial or complete hair loss. 4. Blood disorders. Chemotherapy can affect bone marrow, which produces blood cells. Low white blood cell count, leukopenia, increases the risk of infection. Low red blood cell count, anemia, causes fatigue, weakness, and shortness of breath. Low platelet count, thrombocytopenia, leads to easy bruising and bleeding. 5. Immune system suppression. Increases vulnerability to infections, requiring precautions to avoid exposure to germs. 6. Skin and nail changes. Dry, itchy, or discolored skin. Brittle or discolored nails. 7. Neuropathy. Tingling, numbness, or pain in the hands and feet caused by nerve damage, peripheral neuropathy. 8. Kidney and liver damage. Certain drugs like cisplatin may affect kidney or liver function, requiring regular monitoring. 9. Hearing loss. High doses of platinum-based drugs like cisplatin can lead to tinnitus or hearing loss. 10. Emotional changes. Depression, anxiety, or mood swings may result from both the physical and emotional toll of treatment. Managing chemotherapy side effects. 1. Nausea and vomiting. Anti-nausea medications like ondansetron or metoclopramide. Eating small, bland meals. 2. Mouth sores. Use a gentle mouthwash or prescribed rinses, e.g., chlorhexidine. Avoid acidic or spicy foods. 3. Fatigue. Rest as needed and engage in light physical activity to boost energy levels. 4. Hair loss. Consider wigs, scarves, or hats. Hair typically regrows after treatment. 5. Infections. Wash hands frequently, avoid crowds, and report fever immediately. 6. Neuropathy. Medications like gabapentin or pregabalin may help manage symptoms. 7. Kidney protection. Stay hydrated and avoid nephrotoxic substances like NSAIDs without consulting a doctor. Long-term side effects. Some side effects may persist or develop after treatment, including Chronic fatigue. Lasting neuropathy. Organ damage, e.g., kidney or hearing loss. Important notes. Regular monitoring of blood counts, kidney, and liver function is essential during chemotherapy. Inform your oncologist about any severe or persistent side effects, as treatments can be adjusted. Supportive care, such as palliative treatment or complementary therapies, can improve quality of life during treatment. Proactive management of side effects ensures better tolerance of chemotherapy and improves overall treatment outcomes. In the video, we covered several important aspects related to mouth cancer, including the common risk factors, signs and symptoms to watch for, and the importance of early detection and treatment. We also discussed various treatment options available and shared some tips for maintaining oral health to help reduce the risk. We'd love to hear from you. If you or someone you know has had experience with mouth cancer, please share your story or insights in the comments below. Your experiences can help raise awareness and support others facing similar challenges. If you found this video helpful, please give it a like, share it with your friends and family, and subscribe to our channel for more informative content. Thank you for watching.